Okay. So good evening, everyone. Welcome to today's Africa-China Dialogue. My name is Hong, the founder of China House and the moderator of this discussion. So let me begin with some housekeeping issues. For those of you who are attending this discussion but are not the panelists, you will have your chance to ask questions, but please wait for the end, so we will have some time for you to ask questions. And please mute yourself while you are not speaking. And I want to let you know that this is a public discussion, and we will also share the discussion video for public later on. So everyone who plans to say something on this activity, please keep that in mind. Okay, so now please allow me to briefly introduce China House and the Africa-China Dialogue series. So China House is a social enterprise that brings young Chinese people to work on global sustainable development challenges with the hope of helping China better integrate into the world through youth engagement. And Africa-China Dialogue is our series event that aims to promote dialogue and mutual understanding between Africans, Chinese, and other people. So it includes both online events and offline events in Guangzhou, in Nairobi, and so on. And today's event, we are going to discuss a bit about China's global vaccine delivery to the world, especially Africa. The aim of this discussion is to help people understand better about the topic and what could be done next. And I'm so glad that today we have two great panelists who I'm going to introduce a little bit. So first, Maxi. Maxi is the chairman of the Nigerian Business Council in China. He came to China in 2003 to run a business and now settled in China in Guangzhou. He has a Chinese wife and two young children. Besides, he holds a Bachelor of Philosophy from the Pontifical Urban University, Italy. He's proficient in Latin, Mandarin, English, Igbo, and many other languages, and has published numerous articles on many well-known Nigerian media. So, hi, Maxi.
Hi, Hong.
Yes. Okay, so then I'm going to introduce our another panelist, Eric. So Eric Olander is the founder of the media policy platform in Africa-China relations, the China-Africa project. He's also a journalist with more than 30 years of experience reporting, producing, and managing newsroom for some of the world's leading editorial organizations, including CNN, France 24, and the BBC World Service, among others. Hello, Eric.
Hello, Hong. Hello, Maxi.
Yes. So these are the people. Without further ado, I think we can start by I will be asking questions to the panelists. Again, for those of you who are listening right now and would like to speak later on, please keep your questions and comment to the end. So, hi, Maxi. My first question is to you. Right now, can you share a little bit? Like, we are all under the challenges of COVID-19. And we are quite familiar here in China about the situation in China, but we really do not know enough about what's going on outside. Could you share a little bit with us, how is the situation of the pandemic right now in Africa?
Yes, thank you so much. It's my pleasure to join this dialogue. Yeah, from the onset, the situation in Africa has not been so extreme, so the pandemic in Africa is still at the low. For example, the last data I have is 0.033% of people infected. You can see it's very low. So, and I have information about Africa every time because I travel back to my country, Nigeria, every year, and I always call my parents almost every day to find out what's happening there. I call my brothers and sisters. So I'm giving you first-hand information about the situation of COVID-19 in Africa. So it's still very low. It's not as serious there compared to other areas and regions.
Why? Why is it so?
Why is it so? Yes. I think it's because not many people who have contacted it traveled to Africa. That's number one reason. And many people feel it's because the hot weather of the region makes the disease to be so low in Africa. So you hardly hear about people dying of COVID-19 in Africa. It's very low. So that's the reason.
So the situation of COVID-19 is not too bad like in Africa if we are comparing it to like Europe, America, and so on.
Exactly.
So under this situation, then like are the local people like in Africa, are they expecting like vaccine or any kind of like support like that, or they don't feel they are in need of a vaccine at all?
Yeah, like I said, it's not much there. So, but people think prevention is better than cure. People think safety should be number one. Okay, so they are also expecting the COVID-19 vaccine, at least to prevent from further, affection, of the disease.
So they are still expecting like vaccine, and so are they getting vaccine right now? Like based on your recent communication with your friends and family like in Africa?
Come again?
Yes, like recently, like based on your communication with your friends, your families in Africa right now, like are the people getting vaccine right now?
Not really. They're expecting vaccines. They're expecting vaccine from, they're expecting it.
Yeah, but are they getting it right now?
For now, it's not there because they're still expecting.
I see. So based on your understanding of the local situation, so if the African people they are right now expecting vaccine, like where potentially could they get this vaccine?
Actually, they are, when things concerning food, drug, you need to expect it from, a friend, a trustworthy friend, you don't take it from anywhere, So I think they're expecting the vaccine from China mostly. And as I speak, China has provided, about 35 countries, So they're expecting more, from China.
I see. So here I want to like turn to Eric. Like Eric, could you please share a little bit with us about the situation of like China's global vaccine delivery right now? Like how is the overall situation of this like China giving vaccine like to the world?
Sure. So China has shipped about 65 million vaccines around the world. The vast majority of that has gone to South America and also to here in Asia. Very little has actually gone to Africa. So 1/10 of the amount of vaccines that have gone to South America from China has gone to Africa, only about 6 million doses. So China is giving a lot away in terms of the number of states. So as Maxi pointed out, 35 states, but the quantities are very, very low. So we're looking at 100,000 or 200,000 per shipment that are donated to just Cameroon. We've seen into Seychelles and so forth. So 100,000 vaccines, while it sounds good, is only 50,000 people. And in a continent of 1 billion people, you can see that that's not very many. So Africa right now, worldwide, has received less than 2% of all global vaccines, and 93% of all the vaccines that have arrived in Africa have gone just to 10 countries. So the distribution is not equal within Africa. Most of that is going into South Africa, Morocco, some of the wealthier countries within Africa. In terms of infections in Africa, Maxi's absolutely right that overall the numbers are quite low when you look at it as a continent. But when you look at it on a country by country level, so for example, South Africa has had 1.5 million infections. So in Nairobi as well has struggled in it. So you have to look at it on a more micro basis to understand the impact of it. As a continent, sure. But we don't really look at continents in this kind of sense. We don't look at Asia. We don't look at Europe. We look at it at a country level. And in that sense, Africa is a more mixed picture. Also, the other difficult part about Africa is that the reporting mechanisms for COVID are not as strong. So we don't have entirely the most accurate data in terms of what the true infection rate is, which is one reason why South Africa is tracking upwards, because they have a more sophisticated data reporting system than, say, Botswana does, or Malawi, for example.
I see. I think some of our listeners, they may not be very familiar with the whole situation of this like vaccine diplomacy and also like global vaccine deliveries. So overall, right now, how would you comment on like China's global vaccine delivery?
Yeah, so there's a lot of, again, they've distributed about 364 million doses.
Mm-hmm.
Most Chinese people mistakenly think that has all been donations. The actual reality is that very little has been donated. Only 14 million doses have been donated around the world. So 350 million doses have been sold. And the problem is we don't actually know how much they've been sold for. So much like China's loan contracts with African countries, which are highly secret, we don't know what the interest rates are, what the terms are. It's very, very secret. We also don't know the price of the vaccines, but the ones that we have seen, so Senegal, for example, just paid $19 a dose for Sinopharm vaccines and so that is very, very high. And when you compare it to, say, the $3 a dose that it will charge, COVAX will charge, which is the Global Vaccine Alliance. In Hungary, China was charging $37 a dose. So these are very expensive in some cases. But again, we just don't know, are they cheap? Are they expensive? It's hard to tell right now. And the problem is, though, is that many countries in Africa and South America and here in Southeast Asia, they don't have any choice. They have to take the Chinese vaccines simply because the rich countries are hoarding all of the vaccines. And there is nothing. So an expensive vaccine is better than no vaccine right now. And that's really the big dilemma that many developing countries and poor countries face. So here in Vietnam, where I am, we're not going to have a vaccine until 2022, possibly 2023. And that's in Africa. They're talking 2023, 2024 by the time that the vaccines make it all the way through the population. So that's a very difficult situation.
So I think that's an important context that we need to know. So because based on what you say, essentially the vaccine China is providing, a lot of them is not free, and some of them they're actually quite expensive. So
what we know, yeah.
Yeah, but as you said, on the other hand, like right now, China may be some of the few countries who are providing this global vaccine delivery. Is that the case? Like, I'm really not familiar with it.
So right now, Russia is providing them. India used to provide them, but India is not. And China is making them available. And then there are some smaller ones. So Japan is producing vaccines, but mostly for its own market. Vietnam is now starting to produce, but only for its market. So but also China now is licensing vaccine production in about 10 countries. But again, that's under a license. It's not under freeing up the IP. And what developing countries, particularly in Nigeria is a very good example because Nigeria has a very strong healthcare sector, very strong medical sector. They have a very strong pharmaceutical sector because they've been fighting infectious diseases for decades, centuries, and they have an expertise in fighting these diseases. The problem is that the intellectual property for these vaccines has been locked up by the different countries. And what President Buhari and other African leaders are saying is free up the intellectual property so that a country like Nigeria can open up a manufacturing plant to start creating the vaccine at the lowest cost possible. So when China says it's doing everything to make its vaccines available as a global public good, which is what President Xi said back in May, well, a lot of people are questioning that because, again, selling Senegal a vaccine for $19 a dose, it's good because Senegal has access to a vaccine, but it's not necessarily what people think of as a global public good. A true global public good with Sinovac, Sinopharm, CanSino to make their intellectual property available to a country like Nigeria that can actually produce it. They have the skill to do it. They have the know-how to do it. And that could produce vaccines at the largest quantity at the lowest cost, but that hasn't happened yet.
So based on what you said, I get a feeling that right now China's global vaccine delivery and support is not really that positive. It's not really.
No, I don't say that. No, that's not at all what I'm saying.
Yeah,
There's a lot that China should be very proud of. And in many ways, it is doing a lot better job than what other countries are doing. It's just not exactly the way that I think a lot of people perceive it to be. It's more complicated than a lot of people perceive it to be. And so that's the key part. It's not that it's good or bad. It's just more complicated. So it is making vaccines available. That is true. Very important. And the fact that they're for sale and maybe more expensive, well, that's okay. The fact that Chinese vaccines are not of the same quality as US vaccines, the Pfizer vaccine or the Pfizer BioNTech or the Moderna vaccine, because there's something called an inactive vaccine, which is what Sinopharm is, and then a messenger RNA vaccine. And this is what Dr. Gao Fu of the China CDC was talking about when he said that the Pfizer vaccine is of a higher quality than the Chinese vaccines. But again, the calculation for many developing countries is it may be more expensive, it may not be of the same quality, but it's the only thing that we have. And as long as those rich countries are hoarding everything, and what I mean by hoarding, the United States, Germany, Canada, Japan, South Korea are buying 7, 8, 9, 10 times as much as they need. So a country like Nigeria will go to Pfizer and say, we would like to buy some vaccines. And Pfizer says, I can't sell you any vaccines because they've already bought everything. They've paid for it in advance. And so they go, well, what do I do? Well, we have the COVAX Alliance. Well, the COVAX Alliance was all dependent on India to make those vaccines. But India, the rates have gone up very, very high now in infections. So India has stopped exporting through COVAX. So now we have a big problem because Africa is going to depend on COVAX. That's where most of its vaccines are going to come. We're talking about, for Africa is going to need somewhere around 1.5 billion doses of vaccines to inoculate a population of about 1 billion people. So that's mostly going to come from COVAX. It will not come from the Chinese or from the Russians or others. They will help, but the big bulk is going to come from COVAX. But so long as India is not producing for export, we have a very big problem.
I see. So here there are two things that are not very clear. So first, you are saying the rich countries are now like getting the vaccine that they may not even need, while at the same time, like the poor countries, they're not getting it, and the rich countries are not selling the vaccine to the other countries in need.
Correct. That's exactly it. That is, and they've bought way more than they need, and they're not selling it, and they're blocking exports, and they want to make sure that, listen, the rich will eat first. There's nothing different about this crisis than anything else in human history. The poor have always gone last. The poor always eat after the rich. And the fact that people are shocked and surprised that all of a sudden now Africa and South America and Southeast Asia are going last is kind of surprising to me, because that's what's been happening from time beginning. The rich go first. That's just the way it is. I
see. So, but why the rich countries are getting vaccines that is even more than what they need?
Well, they want to make sure. So the problem was they wanted to place bets because they weren't sure, is Pfizer going to work? Is Moderna going to work? Is Johnson & Johnson going to work? So if one of them didn't work, or there was a delay on the one, they bought for the other. So they put money, so it's like going to the casino and you put your money down on everything just to make sure that you have and you're covered. And when they put their money down on everything, they locked them up. And they said, okay, we're going to buy, way more than we need just in case, because President Joe Biden cannot be seen giving vaccines to Nigeria, because people in Oklahoma will say, we are suffering. Why are you giving this to Nigeria? Now in China, you don't face that same pressure. So that makes it easier. Number one, in China, you don't have the same rate of infection that we have in the United States. So there's not the same pressure. And number two, you don't have the same political system in China like you do in the United States, where people can scream and yell and get attention. So the politics are different too. And that makes it more difficult for a leader in Europe or the United States to divert vaccines to other countries when their own countries need them very badly.
I see. So when you say, like, despite like China's vaccine has some kind of like quality issue and also the price issue and so on, you say China should still be proud. Is it because they are still the only one, or I say one of the few people who are supplying?
China should be proud for making it available, and that is a very good thing, because it has been a tremendous moral failing of the rich countries. And let's not say the West, because it's not just the West that's failed in this. South Korea is not shipping vaccines. Japan is not shipping vaccines. Singapore is not shipping vaccines. The United Arab Emirates, a little bit. So this is not a West-China thing. This is a rich-poor thing. I think that's a really important thing. It's very easy in China to always say the West, the West, the West, the West. But this is not the West. This is the global North and the global South. And those are two so it's a class thing more than a politics and ideology thing. But the problem we've also had with the Chinese vaccines is they have not been transparent on their data. So on the phase 3 clinical trials, and that's been one of the delays in getting the World Health Organization what's called the pre-qualification certification. So a lot of countries in Africa cannot take a vaccine until it has the WHO. That's their national laws. Must be WHO certified. But it cannot be WHO certified unless WHO requires all of the documentation. China has not been forthcoming with all of the documentation, and that's been a delay as well. And that's one of the reasons why people are concerned about the Chinese vaccines. And when Dr. Gao said that, it confirmed what a lot of people thought, that they are not as effective. And again, no vaccine is perfect right now, but there are two technologies of vaccine, the inactive and the messenger RNA. The Chinese use the inactive, which is an older technology. The mRNA is a newer technology. And the Chinese are now working on an mRNA vaccine that is going to be distributed, but that will be next year or the year after. So that's some of the dilemmas, but it's not a good or bad thing. I don't think that's a good way of looking at it. It's a complicated thing.
I see. So Maxi, here I want to turn to you again. Like, so as Eric has pointed out, there are like some issues that China should be proud of, and there are some kind of like price issue, quality issues. Like, how do you see like China's vaccine delivery to Africa, and how do the local people think about it right now?
Here, there is some recent news now about quality. China's vaccine received a certification, okay, from Hungarian Institute of Pharmacy and Nutrients, okay. So I think it's also good for China. The certificate makes the Chinese vaccine a GMP, okay, good manufacturing practice. So that's the certificate, okay, and it makes Chinese vaccine now to be more popular and acceptable to people because it's a good certificate, and it's not from Asian countries, it's from Europe, and that institute is a very high institute to give China that kind of certification. So people are accepting the vaccine now in Africa because of that recent certificate Chinese Sinopharm got from Hungarian Institute of Pharmacy and Nutrients.
I see. Maxi, I want to ask you, like local people right now, like in Africa, the African people right now, like how do they think about this Chinese vaccine? They think of it like as good or like bad if we put this in a simple way. Like how are they thinking about the Chinese vaccine right now, based on what you
think? I've called a few people, and a few some people they think it's good, and I have some top officials here in China who have taken the vaccine, and I also report to my people. So the local people in Africa, I think that they feel the Chinese vaccine is good.
But are they, for example, are they, because as Eric has pointed out, there's like the price issue and so on. So do the local people in Africa right now, do they like appreciate China's vaccine like delivery to Africa right now? Or they think no, it's low quality, is expensive. Like what do they think?
In terms of price, like Eric pointed out, it's still a secret. Sometimes it's trade by barter. I give you a vaccine, and some Chinese is also donating, but we are not very clear, donating some, to some poor countries, third world countries, But if you talk about price, we are not sure about the price they are supplying to African countries.
Because based on what I understand, like from China, like when China is giving this vaccine support to other countries, including like countries in Africa and so on, they are also wishing that they are wishing that the local people would be thankful for them. You see, where the like American, like the British, where they're not supporting them with vaccine, but China has stepped up to support them. Like, do they get this kind of response like from local? Is that kind of like working? Do you think the local people in Africa, do they appreciate this Chinese vaccine support?
Exactly. As I told you, you're expecting it. They appreciate, they appreciate the Chinese, way of life of, giving them the vaccine or donating or giving by trade by barter. Okay. I'm not sure the price, but I am sure that the local people will appreciate the Chinese, magnanimity,
But are they concerned about the quality, for example?
Like I told you now, it's in the news that the Chinese vaccine has received a certificate from Hungarian Institute of Pharmacy and Nutrients. So there is that institute giving you a certificate, which means the quality is good. It's not a low institute. Okay, so it's on the news. So Africans saw the news and they think it's quality is not a problem. Since they have got that GMP certificate.
I see. I'm curious. So, if given a choice, like for example, your people in Nigeria, they can choose to take the Chinese vaccine or the US vaccine, which one would they take? I'm
Yeah,
just curious.
sometimes it's personal. It's personal. It's personal. For example, you're gonna ask me, if you ask me to, to take. I live in China. I know how it is. Okay, and also my people. I've told them about that. I think that they prefer Chinese vaccines. They prefer that. You see, let me tell you the reason. Some part of the world are clamoring or campaigning, that African population is much. They want to reduce the population by all means. So Africans have that feeling, if you supply us this vaccine, won't you add anything there to, to reduce or to tamper with the fertility or something like that? So they prefer, I think that we prefer Chinese vaccines to other vaccines.
That's a little bit weird to hear, but yeah, but thank you for your feedback. So Eric, I would like to come back to you on the same question. Like, I know you have been always communicating with many people in Africa and so on. Based on the information you get right now, how do the local people in Africa see China's vaccine delivery to them? I would like to know both good side and bad side. Like,
well, it's not a good side or bad side. I'll respectfully disagree with Maxi a little bit, because I think Chinese vaccines come already with a lot of baggage. You have to remember that in countries like Nigeria, that counterfeit medicines are a plague, and fake medicines. And every year there are millions and millions and millions of counterfeit medicines that are imported from China and from India. This is a problem that goes back decades and decades and decades. This is not a new problem. And this is a problem throughout the continent. And just last week, last month, I'm sorry, back in March, Interpol intercepted thousands of fake vaccines in South Africa. And this spread quite a bit, and it really brought up the concerns about the presence of counterfeit vaccines. Now, remember, counterfeit vaccines and counterfeit drugs are a problem in China too. This is not simply uniquely outside of China. This is something that the Chinese government is fighting domestically as well. You can go onto Taobao and buy fake pharmaceutical goods today. And so the opinion surveys that I've seen, the people that I speak with, are not quite as enthusiastic about Chinese vaccines and Chinese pharmaceuticals as I think Maxi's circles are, in part because of the concerns that they've had over many, many years regarding counterfeit and fake pharmaceuticals, and the arrival now of fake Chinese vaccines into Africa. And the Nigerian government just about two weeks ago issued a very, very strong warnings, and they've set up a team, a dedicated team, and all of the vaccines are going through the port of Lagos and arriving in Lagos. And there's only one point of entry, and they've really set up this really tight way of certifying the vaccines that come in, because of the concerns of counterfeit vaccines and counterfeit pharmaceuticals and medications in Africa that don't just come from China, but they come from a lot of places, but they do come from China. And I think a lot of people have had some negative experiences. Let's be honest, Made in China is still not a brand around the world that is comparable to Made in Europe, Made in Japan, and Made in USA. And that's something that, again, even Chinese consumers will say that about products. They would prefer oftentimes to buy a foreign brand than they would to buy a Chinese brand. That is very common in China, so this is not actually a criticism there. It's still very, very common today. So I think that does extend into it. The problem is, it's not like a lot of people in Africa have a choice right now. This is not that they have a choice between Pfizer, Moderna, and Sinopharm and Sinovac. That is a fake choice. Right now, it is you will take Sinopharm or Sinovac because that is all there is. Or you'll take Sputnik 5, or maybe one of the, you get Covax. Now, this is only a temporary problem. Let's be very clear here. Next year at this time, there will be billions and billions of vaccine doses all over the world. There'll be plenty of vaccines for everybody. So the production is ramping up. Sinopharm and CanSino just said they're going to produce 3 billion this year, 5 billion next year. India will be back up and producing billions and billions. The Europeans, the Americans will be producing. So the shortages that we have now are just temporary until the manufacturing can get up. Most of those, again, will not come from China. Most of those will come through COVAX. And the COVAX is where most African countries are going to get the bulk of their vaccines. The Chinese have contributed to COVAX, but they've only contributed 10 million doses to COVAX. So think about this a little bit. 10 million doses, let's use the price of Senegal, $19 a dose. Okay, that's a $190 million donation. That's a nice donation, but the United States has given $4 billion to COVAX. Europe has given billions to COVAX. So China's contribution to COVAX has been very, very small. And that's another area where we're hoping that China will step up and do more to support multilateralism and to support the global effort through COVAX rather than these bilateral deals, which we don't know about. We don't know, as Maxi said, we don't know the contracts, we don't know the rates. But COVAX, it comes in at a dose of $3 a shot. That is the maximum that COVAX will charge a country, is $3 per dose. And that's a very, very good price. So I'm hoping that by next year, China will be more engaged with COVAX, less in the bilateral donating, and that COVAX will be able to facilitate a lot of the problems that we have now and ease the supply problems.
So essentially you are saying like China now is more interested or is more active in bilateral support.
It's all bilateral. It's except for the 10 million doses. So they've given 10 million to COVAX. They've given 300,000 to the Arab League, and they've offered to give to the International Olympic Committee. That's the only multilateral. Everything else that they're doing is bilateral.
And why is it so? Like based on what you know?
I don't know. I mean, I think that, it's very confusing simply because Xi Jinping and Chinese leaders have all said that they embrace multilateralism, that they support multilateralism, but in this particular case, they prefer bilateralism. And in this particular case, it's the United States and Europe that are supporting multilateralism, through COVAX, because that's where the bulk of the money is. Now, let's also remember that while the Chinese have gotten a lot of attention for their vaccine donations and their vaccine sales in Africa, you have to remember that the amount of public health contribution that the Chinese make in Africa is still very, very, very small compared to the US and Europe. The United States alone spent $10 billion on PEPFAR. So, you compare, so that's really important that Africa has a lot of public health needs beyond just COVID. And that's still being provided through the European Union, through the United States Agency for International Development, through Japan's aid development agencies. So I think when we look at aid, we have to look at it more broadly and not just through COVID, because public health agencies in Nigeria and elsewhere are fighting a lot of issues right now, not just COVID alone.
Okay, so back to the main topic we discussed today, which is how African people see the Chinese vaccine delivery to Africa. So Eric, based on what you said, so you are saying that a lot of people on the ground in Africa, they have these concerns and they are taking the Chinese vaccine because they don't have a choice. So can I understand it as that although China is trying to have this vaccine diplomacy, like yes, the local, like people in China, they may not have enough, but we are giving some to people like in other places of the world, like including in Africa and so on, but they're not really getting the feedback that they would like to, which is local people's appreciation.
I don't think the local people are thinking about it right now, because remember, as I said, only 2% of the total vaccine distributions have gone to Africa, and 93% of that is into just 10 countries. And within the countries that have received vaccines in Africa, it's very small numbers, a few 100,000. Namibia just got 100,000. These are countries of tens of millions of people. So it's like here in Vietnam, we're 100 million people here. We've received 80,000 vaccines. The average person on the street they're not getting vaccinated. They're not even thinking about it. So it's an academic question as to whether or not they like Chinese or European or Russian. Who cares? I don't have a vaccine. I'm not going to get a vaccine anytime soon. I'll worry about it when it actually is an option for me to consider. But right now, it's not an option for me to consider. What China has done super well, though, is that they've done very well at providing elites in these countries with the vaccines. So we saw a picture of Macky Sall get the president of Senegal. He got his injection. The president of Comoros, Constantino Chiwenga, who's the vice president of Zimbabwe. They're all getting Chinese vaccines, and they're all getting their picture up on Xinhua. Very effective soft power diplomacy, because these leaders are going to appreciate China for what they've done. But in terms of the Laobaixing, in terms of the people on the ground, no. There's no, because they're so far away right now from getting a vaccine, again, like here in Vietnam. And what the situation in Africa is not that different than many other developing regions.
Maxi, what do you think of like what Eric said?
Yeah, I think in the future we have enough vaccines, but for now we don't have enough. It's for the rich people having it for now, but the people on the street don't have it for now. In the future, by next year, it will be enough for.
That's right.
The people.
And next year we won't. This conversation will be very different next year.
So Maxi, do you agree with Eric that the local people in Africa right now, they are not even thinking much about this vaccine from China, based on what you know?
Like I told you, they've not seen it. Okay, so they're not thinking about it for
That's
now.
right.
They've not seen it. If they see it, they'll begin to consider or check if they, what do we say about it. You understand?
That's right. That's right.
Mm-hmm. So back to Eric then. So I have a question. So like when we look at this China's vaccine diplomacy, what do you think like it can be improved?
Well, I mean, they've done a super good job at providing vaccines to countries, particularly in South America. And I think the vaccines in many respects reveal China's diplomatic priorities. And one of the things that I've been saying for quite a long time is that Africa is becoming less and less important to China overall. African resources are less important to China than they were 15, 20 years ago, simply because now with the Belt and Road, the oil, mineral, and timber that they bought from Africa, now they can buy from lots of different regions. Remember that China does a third more trade with South America than it does with Africa. The oil buying that drove a lot of African trade has shifted now to Saudi Arabia, Iraq, and into the Persian Gulf. And you're seeing the diplomatic priorities of China follow where the vaccines are going. So the two most important places right now for China diplomatically are here in Southeast Asia, because that's where the battle with the United States is going to take place in terms of influence. Also, South America is the second most distributed place for vaccines. And that's where they're getting more food, more oil, more minerals, things that they are displacing Australia and the United States for. And then the third largest place that they're donating vaccines and where they're doing manufacturing is the Persian Gulf, which is not surprising at all either, simply because that's where the oil is coming from. So again, I told you a statistic at the top of the show, which is only 1/10 of the number of vaccines have gone to Africa, has gone to Asia and South America. And I think that in many ways reflects the diplomatic priorities of China, that it's at the bottom of the food chain. And that's just, it does the least amount of trade of all the major regions in the world is with Africa. So China-Africa trade is at 187 billion. China-South America trade is at 300 billion. China-Persian Gulf trade is at 240 billion. And China-Southeast Asian trade is at over $1 trillion. So you can see the vaccines follow the diplomacy and the trade. And in that respect, that makes sense why they've put vaccines where they have. There's a logic to it. It's not just random.
I see. So what else do you think like China can do like in terms of like improve the vaccine diplomacy?
Well, I think transparency will always be better. So number one is to be, as Maxi pointed out, that they got approval from the Hungarians. They should be more to work with the World Health Organization again to get their vaccines pre-certified and pre-qualified. I also think that they should support the Gavi coalition much more and the Gavi alliance, and that is the COVAX, and to really embrace multilateralism. That is really important. And if they could, make their contracts transparent, so that African taxpayers who are struggling under enormous weights of debt, some of it to China, know exactly what their countries are paying for the vaccines. That is really important. I think African taxpayers and African constituents have a right to know how much their governments are paying for Chinese vaccines. And so I think that China should take the lead on this to ensure that all of its vaccine contracts are transparent, so that people in Kenya, in Mozambique, in Tanzania, in all over where they're getting vaccines know exactly what's going on.
About this, I have a question regarding like when we're talking about price. So you're saying the Chinese vaccine is actually quite expensive. It's like $19 per dose and so on. And
only with Senegal, only with Senegal. And again, it varies. Hungary was $37 a dose. That's the only two contracts that I've seen that we know. So I just want to be very clear that it's not necessarily like that all around the world.
I see, but I have a question regarding the production cost. Like based on my understanding, or I say my guess, like Chinese vaccine should be cheaper than like US vaccine. Am I understanding right?
Not necessarily. Not necessarily. I mean, again, each vaccine has, you know, what they're doing and the scale and the production methods. There's different pricing factors that go into it. So it's not necessarily that it should be cheaper.
Ah, but based on your understanding right now, which vaccine is cheaper right now in terms of international cost?
It depends. I mean, the Gavi Alliance and the COVAX Alliance is $3 a dose. So they've intended that. So, but that's a subsidized rate. And that's because the United States has provided billions of dollars and Europe has provided billions to the COVAX Alliance to pay the difference in the price and then sell it to a developing country government for just $3 a dose. The price of the vaccine depends on the country. It depends on the type of vaccine. So it's very difficult to get an accurate, precise level on across the board. Each vaccine is at a different price depending on where it's manufactured and who it's manufactured by.
I see. And Maxi, how would you comment in general right now China's vaccine delivery to Africa right now? Like how will you comment overall? Like what has China done is good and what has China done is not enough? Like what would you say?
I think they have done enough, in Africa. Some of the vaccines are being donated, is we're talking about price, but like I said, some are given out of trade by barter, and some are being donated because China sometimes consider very poor countries. They think there's no need to sell to them. They will donate to those countries, So we have to consider also, the donation they're making to some countries, whom they consider as their friend, and also in very poor, they don't need to charge them. So I think overall, I think they're doing a good job there about the vaccine, giving out to people and different countries.
Okay, then. So I think we can now start to give some time to the other people in this conversation to ask questions or to give comment. And I can see there's one question from Kiko. So I'm going to read about it so that later on people who watch the video can know the question as well. So my question is from Kiko. Every country does things for the sake of national interest. Then China is doing a reasonable act. After all, the country is not a charity. How do you think about such a statement? I think this question maybe both Maxi and Eric, you can try to answer.
Yeah, it's not a charity. And China, I mean, China has made it very clear that it is not donating a lot of vaccines. And that is, again, I mean, I'm looking at the numbers here. This is from Bridge Consulting, a Beijing-based consultancy agency. 639 million doses sold, 15 million doses donated. So that's a very small percentage, and that's a problem. Now, the problem with thinking the way that Kiko is saying, and I think Kiko is just trying to ask the question, not necessarily that Kiko thinks this. This is the problem here. If we don't get the vaccines to the poorest countries and the poorest regions, it is so stupid and so selfish and so short-sighted, because the longer that it takes for these vaccines to make it to places like South Africa, Nigeria, Brazil, the more time that variants have to develop. And the variants are going to become meaner and nastier, and they're going to poach a hole right through those beautiful Pfizer, Moderna, J&J vaccines. So countries have a self-interest to make sure that Nigerians get inoculated very quickly in order to reduce the chances of the variants coming that will underwhelm and undermine the vaccines that the rich people are taking. So it is a very, very stupid and short-sighted act. That's number one. Number two, remember that the vaccines now is part of the contest between China and many other countries around the world. This is a diplomacy. This is geopolitics today. Nothing is off limits today. And countries are fighting each other now in the war of public opinion. So China may not be a charity, but it is in its long-term interest to make sure that it builds as much goodwill with the world that it can, because China right now is facing a number of different challenges with a lot of countries, not just a few countries, a lot of countries. And these vaccines can provide a real opportunity for them to build goodwill, not just with the leaders, but also with the people that Maxi's talking about, the everyday people. So if those vaccines come in, people will realize and remember who was there when they needed them. And they will remember who was not there when they needed them. So if China is able to bring down the price and get the vaccines into people's arms all across Africa and all across the poor developing global south, then that will change public opinion and perception of China, which right now China desperately needs because it needs all the friends it can get.
And Maxi, how would you answer this question?
Yeah, like I said, she said China is doing a reasonable act, and China has been, China is not a charitable country, right? So, but they have been helping, various countries, they've been giving aid. For example, when the COVID-19 came early, China sent their medical personnel, to some, countries, some developing countries without any cost, as an aid, So the vaccine also, China, we send it not as a charity, but as an aid, to developing countries, I don't agree that, China has maybe, Chinese, the name of the China is bad in various countries. China is still friendly and has a lot of friends in various countries, So I think the vaccine will be an added, an advantage for China and the Chinese name,
No, but let's be very clear that China does have a lot of problems right now in Europe, the United States, Australia, Japan, South Korea, here in Asia. Let's not be naive here. I mean, yes. China's having a difficult time internationally right now, and let's not pretend that it's not having a difficult time. And even in Africa, there are a lot of difficulties and questions right now about the debt relief situations in some African countries. But yes, China is well-liked, but it's not universally well-liked, like no major country is universally well-liked. The United States, too, has the same difficulties. But I don't think we can pretend that, it's happy everywhere.
Yes, Eric, I understand you, but I think it's more of politics. It's more of politics.
It is politics. But politics is part of this. You're absolutely right. It is politics.
Example, those countries are talking about, there's no way China has offended them or, officially, So, for example, I see that some countries see China as a threat, When someone is growing up, they see, and China is building up, is growing from strength to strength. So they see China as a threat, They want to stop, stop China from growing up. So that's the problem. For example, China has never invaded any country. China is not fighting any war with any country, unlike other countries that they've been invading other countries, because of one reason or another. I've not seen China. Been living here for a long time. I've not seen China done that, invading any country or fighting any country. So those countries you mentioned having problem with China, I think it's more of politics, not anything they have at hand that China has offended them in any way or another.
I see. So for that question, I would like to, maybe for that question, we can finish there. And then I see Sylvia is asking Maxi a question. May I ask how your friends in Nigeria think of Chinese vaccine? Like maybe Maxi, you can share with us some of the stories of your friends in Nigeria. Like who are they? Like what are they thinking? Like did you communicate when you communicated with them? Like what did they say?
Yes, I communicate with them, with my parents and everything.
Yeah.
They think Chinese, vaccine will be a welcome one, because from every indication, China wish them well. So, vaccine or drug should be should come from any person you trust. Like I told you, you don't take it from anywhere. Don't know what happens, So they will welcome Chinese vaccine whenever it comes. For now, they have not seen it, So I think they think or talk good about Chinese vaccines. They welcome it and they wish it comes as quickly as possible. But then the COVID-19 is not so serious. It's not it's not on a high alert in my country, Nigeria.
I see. And I see another question from Kiko. So Kiko's question is, may I ask if the African media are biased in their coverage of China, since some rich countries block the vaccines, and at least China offers some vaccine, like although the quality and price may have some issues, why there are still so many bad news about China, but relatively less bad news about the global north? Like maybe Eric and Max, you can address this.
I mean, that's a very common Chinese insecurity, but it is not rooted in any kind of fact or reality. The fact is that you look at African media and they're very, very skeptical and negative towards Europe and the US in many respects. So the history of Europe in Africa is not a happy, pleasant one. And so when you look at the coverage of France, for example, in Africa, it's very, very negative. So it's not that, everything about Europe and the US in Africa is great and everything about China is bad. You look at the Nigerian media, for example, and it's, there's a lot, they have some great news coverage in Nigeria, some great newspapers, the Premium Times, the Nation. These are great newspapers, and they cover, sometimes it's good about China and sometimes it's not good. I mean, it's a real mix. So I don't think that it's either good or bad in that sense. And I think it's dangerous to start thinking about the world in that way, in that very simplistic binary term of anti-China, pro-China. It's far more complicated than that.
Maxi, how will you answer that?
Yes, I think it's a mix up, okay? But we have more percentage, talking about, the good part of it, There's no country everyone we like at the same time. We have people who don't like you. It's natural, But you consider the percentage, What's the percentage that like you? What's the percentage that don't like you? So that's it. I think for the percentage that like China or talk good about China is on a high percentage.
I see. And I get another question from Yunong. As Eric said, the US and European countries are occupied by their own troubles. But what if they finally get through the outbreak domestically and have the available capacity for bilateral support? What's the possible choice that they would make? Would there be a kind of diplomacy competition between China, India, and the US and other countries?
Yes. So what we're seeing going to happen is the United States looks like it will reach some kind of herd immunity by about June of this year. So quite quickly. So we're vaccinating very, very quickly in the United States. And at that point, then the vaccine production will shift to go internationally. And that's when and they're going to funnel things through two different channels. Number one is going to be funneled to Gavi and the Global COVAX Alliance. So we're going to start to see not just money, but also lots and lots of vaccines, particularly the Johnson & Johnson vaccine, which is having some difficulties right now, but that's just a temporary difficulty. And that's very well suited right now for Africa, because it is like the CanSino vaccine, which is, it does not require a cold chain sub-zero cold chain. It's one shot, it's much lower cost, much easier to transport. Here in Asia, it's a different story, because it looks like that the United States is going to partner with the Quad, with India, Australia, and Japan, and they've already reached an agreement to distribute 1 billion vaccines here in Southeast Asia. That's where the vaccine diplomacy between the United States and the rivals in Asia is going to take place. So that's why here in Vietnam, Vietnam, interestingly enough, has banned all Chinese vaccines. So we're the only Southeast Asian country. There's no Chinese vaccines in Vietnam. There's no Huawei in the 5G network either. But, and again, Maxi, I think you should read your history a little bit on China invading other countries. China occupied Vietnam for 1,000 years. Let's just be very clear about the history here. And I'm not suggesting that, but that is what you're saying is not entirely true. And I hope that you'll take some time to look at the history of China and Vietnam. It's a very complex history. It's not as clear-cut as you suggest it to be. And so the politics and the history here are very, very sensitive and very, very mixed. And so Southeast Asia is going to be the place where the US, Japan, Australia, and the Quad are going to kind of distribute vaccines separate from COVAX. That's what they're saying, at least.
Eric, I just want to ask a follow-up question. So based on what you said before, US is giving quite a lot of money to COVAX and so on. So right now, how is the US vaccine kind of support, maybe not direct support, like giving vaccine directly away, but how is the US doing right now regarding, for example, vaccine support to Africa right now? Can you
no, so vaccine, they're not giving any bilateral. They're giving it all through COVAX.
Yeah,
So they're giving, but that's it. That's all they're doing right now. But that's an important thing so that COVAX has the money to buy the vaccines to distribute to all poor countries, not just in Africa as well. If COVAX doesn't have the donations from the member countries, then it will not be able to purchase those vaccines. So that's where the United States and Europe are concentrating. But again, that's temporary. By the end of the year, the US will probably be shifting millions of, and possibly hundreds of millions of doses into COVAX and also here into Southeast Asia directly.
I see. I would like to just make a small comparison. So you say essentially US is giving money to COVAX, and then COVAX is giving out to other places like Africa right now, right? And China is not giving much to COVAX, but it's giving some directly to Africa. So right now, if we do a little bit comparison, if we look at no matter the money or say like the quantity of vaccine that we can calculate from the money, how will we compare like the support from say from US, UK, Japan, India, China to Africa right now? I just want to have a little bit of the big.
I don't think you can compare because they're doing very different things. And again, I think we all want to boil it down to A equals B and B is equals A, and one is better than the other. And I don't think that's the way we should be looking at it. Again, you know, the United States, and I'm not saying to defend the United States, but the United States is the single largest provider of global public health in Africa today. We're talking billions and billions of dollars, you know, to support HIV, to support anti-malaria, to support any number of different things. It has not been able to provide and has not been willing to provide on vaccines. There's no doubt. China has definitely gained the upper hand on that. It's done very well. But let's again be very, very clear here. China's not giving away these vaccines. 15 million out of 639 million is not. Let me go ahead and put in the, I'm going to put in the chat for everybody. This is where I'm getting the data. This is the vaccine tracker from Bridge Consulting in Beijing that is tracking these donations. And you will see straight up 639 doses sold, 15 million donated. So this is a Chinese sourcing. This is not Western. This is not international. This is Chinese. And this is well respected. So again, what they're doing and making the vaccines available is super important. And they deserve to be very proud of it. But they are not giving them away in large numbers. And they're certainly not giving them away or selling them in large numbers to Africa. And that's just a fact. I don't put a judgment on that, but that is just a fact.
And thank you, Eric. And also following up on Yunong's question, I would like to ask Maxi as well. So Maxi, based on what you are seeing there, like in Africa right now, do you see a kind of potential vaccine diplomacy competition between China, India, and US, and so on? Do you see that kind of like competition coming up?
Yeah, I don't see any competition now. I don't see that, you know. So they have not seen it. I'm telling you that they have not seen the vaccine. So when they begin to see it, then we begin to judge.
That's right. That's exactly it. That's right. You can't have a competition when there's nothing there.
So, yeah. So it's the competition. It would be great if there's competition.
That would be great. That's exactly it. If there was Coke and Pepsi together, then that would be great.
I see. And I get a question from Kiko again. Like, I would like to ask Eric, what do you think is the more correct way of thinking about these things? Yeah, I think that's actually a very good sum up questions. Like, so overall, when we're looking at the whole topic of like China giving vaccine to the world, including giving to Africa, how should we see this issue like in a more comprehensive way from different sides?
Again, I think getting it out of this East-West narrative of China versus the US is a really good, important thing to do, because this is not a healthy way of looking at it. Both are doing things that are important. Both are not doing enough. Okay. Both are telling their own people that they're doing more than they actually are. Okay. It's the same thing in the US. If you talk to an average American person about vaccines, they say, we're giving billions of dollars. We're doing everything to take care of the world. We're great. And you talk to the average Chinese person, as you can hear, we're great, we're giving, we're doing everything, but it's not equal and there's problems. I say this in a very, analytical way. I'm not advocating for anybody. I don't care. I'm not pro-China, anti-China, pro-US, anti-US, pro-Europe, anti-US, pro-Africa, anti-Africa. That's not the way I do things. Mm-hmm. The fact is that transparency is really important. That's something we should all strive for. Cost is really important and accessibility is really important. Those are the things that we should be evaluating different countries on. That's the most important thing right now.
I think that's a very good point. To not see the things from like a very simple way, like pro-China, anti-China, is where try to see the complexity.
Not a productive way of looking at it.
That's a very good point. And also, ask a question again, like recently we see the Oxford AstraZeneca vaccine are facing security concerns, and COVAX has distributed this vaccine to many Africa countries. How is the local comment and response to that? And what does that mean to the other vaccine provider to Africa market?
Okay, so just to be clear, so AstraZeneca's run into the same problem that Johnson & Johnson's run into, which is in a very small number of cases, they've had blood clotting in some of the vaccines. So they've stopped some of that, and there's concern that it causes the blood clotting. And so they've cut back, or they've in some cases stopped shipping them because of that. In other cases, like in Southeast Asia, they've looked at the AstraZeneca and they said, you know what, here in Vietnam, that's the case as well. The risk of blood clotting is so much less than the risk of dying of COVID. So you know what, we're going to keep going. So in that case, the AstraZeneca is still a very, very important vaccine. And it's one that, again, it's the bulk of the vaccines are going to be AstraZeneca most likely, because India, through the SII, which is the Serum Institute of India, is the largest vaccine manufacturing production facility in the world. And when they finally produce enough, both to satisfy the Indian domestic market, but also then internationally, the world is going to have a lot of vaccines on its hands. So I think in that sense, again, people, as Maxi has pointed out many times, and he's absolutely right, 100%, if you don't have anything to think about, then you don't worry about it. And again, it's like here in Vietnam, we're not getting vaccines for a long time. And in Nigeria, it's the same way. So we don't think about AstraZeneca or Pfizer or Sinopharm or whatever, because we have nothing in front of us. That's like saying, do you want a filet mignon steak or do you want a McDonald's hamburger? Well, if I have nothing, well, it doesn't really matter.
And Maxi, like, what would you say, like, to Yunong's question? Do you see any local comment and response, like in Africa right now, to this, like the issue of like Oxford AstraZeneca vaccine?
For example, the person wrote Oxford AstraZeneca vaccine are facing security concerns. Yes, of course, okay, because of blood clot, okay, we are stopped, okay. Well, he said that the vaccine has been distributed to many African countries. It's not true, okay, it's not true. We've not received it there in Nigeria. I made a call and tried to search. We've not received it there. So the person saying that it has been distributed to many African countries, it's not the fact, okay? It's not the fact.
About this, I'm getting a little bit confused. So I think one learning point I got is that like China's vaccine delivery to Africa is not much, although it's there, but it's not much. How about COVID's delivery of like vaccine like to Africa right now?
No, not much either. Again, as we pointed out, as I said, 2% of the world's vaccines have gone to Africa. So very little COVAX has gone, in part because COVAX has shut down a lot of its distribution because of India. So a lot of those vaccines to Africa were supposed to come from India. And as a result of India stopping exports, that's hurt Africa in that respect. So Maxi's right. There is not much COVAX and there's not much AstraZeneca. This is the problem. This is really the problem, is that in the developing South, they're not getting enough vaccines.
No matter from who, they are not getting.
No matter from who, they're just not coming. That's correct.
Exactly.
That's correct.
I see. I have another technical question regarding that. So essentially, based on my understanding, COVAX is getting money from different countries to buy vaccine and then to give to Africa, right? And if, as you said, like India has the problem of production, why does COVAX, for example, buy more vaccine from China and ship to Africa and so on?
Because at this point right now, China is not making its vaccines available to COVAX, only 10 million doses. That's all, just 10 million, which again, that's just 5 million people. So when we're talking about billions and billions of people that need to be inoculated, China's contribution is rather insignificant in that respect.
But when you mean contribution, you mean giving them for free, right? What about like people buy them?
Well, right now, China doesn't have the production capacity to do that, because China's production capacity because it has such a large domestic demand for vaccines. Remember that China itself needs at least 1 billion to 1.5 billion doses, for its own large population. And so it can't produce enough domestically and internationally and for COVAX. That's why we're in this problem right now of supply. Next year,
China will be vaccinated, the US will be vaccinated, Europe will be vaccinated. So all of the production will go to the global south. The only thing that we can pray for, and I hope everybody here is going to pray for this, is that a variant does not come along in the time between those vaccines are delivered in the south, in the global south, and where we are now, that will undermine the vaccines. That is really the key question.
Wow, I see. Okay, then I think the discussion now we have like a 1 hour discussion, and I think I'm not sure about the other listener, but I have learned a lot from Eric and Maxi already. So I think if there are no more questions, our discussion can come to an end. And my last question to both Eric and Maxi is that, so from now on, if we're talking about this like vaccine diplomacy, we're talking about China's vaccine to Africa, to other countries. So is there anything else that you think is important for people to remember? Like maybe Eric first and then Maxi. Anything
Most important, yes. This is going to be, we don't want it to be this way, but this is the reality of the world we live in today. Vaccines are political, and it's going to be a political issue. It's going to be one of the many issues between the United States, Europe, China, Japan, India. That's just the way it is. And we just have to kind of factor that. We can't separate the politics from the reality, and politics is a reality. The other thing is that we have to really look at the data. Don't look at the media narratives. And again, you look at the data, and China is giving away very few vaccines, but selling quite a few. That's important, but we just have to understand what the terms are, what the reality is, so that we better understand it. The United States is not giving any away and is not selling any of them. So that's very clear in that respect too. So I'd ask to look at the data. Politics will be a part of it. But at the end of the day, the idea that we are not charities is a dumb, stupid way of thinking about it, because at the end of the day, if we don't understand that this is a global pandemic, and as a result of being a global pandemic, if we don't take care of everybody, then we're not all safe. And that's something that I don't think fully is appreciated in the wealthy countries in the North.
I see. Thank you, Eric. And Maxi, do you have anything?
Yeah, I think the countries hurting the vaccines, they're not doing the right thing, because if one of us is sick, everyone is almost sick, because it might go from that one person to other people. You see, the vaccine issue is also more political. It's politics, which country, do I buy from, which country vaccine do I take, and also it affects person to person exchange, So for example, if you are traveling from one country to another, you might be denied entry because you took another country's vaccine. We don't like that country, so they may not recognize, for example, I'm giving you an example. I took a vaccine made in China, and I'm coming, I have the certificate, okay? I'm going to another country. They said, let me see your certificate. Okay, I took this vaccine from this country. They may refuse the entry. So what I'm saying is this, is the World Health Organization they have to come in this and bridge the gap, okay? And when they recognize any country's vaccine, they will certify it and give a certification, so that each country will trust each other's vaccine and recognize each other's vaccine, no matter where it comes from, as long as it has been certified by the World Health Organization.
I see. Thank you so much, Maxi. And thank you both Eric and Maxi and everyone that has participated in this conversation. I think this conversation is really good, that we hear perspective from different sides. We hear knowledge from different sides. So we get to understand there are many things that they are positive, but may not be as positive as what we have thought it would be. And there are many things that they are challenges, but it may not also be in the same way that we used to imagine about them. So it will be great for us to keep an open mind and trying to see things in a more complex and comprehensive way to understand the issue better. And to also understand that this COVID-19 is really a global challenge for us all. And we all need to somehow work together, understand each other, to hold hands of each other and fight against it together. I think that's very important for us to take away. No matter we are like Chinese, we are Nigerian, we are American, we are all the same. We are human beings, and we need to be friends fighting this together.
That's right.
Thank you so much. So I think our discussion can come to an end today, and we will share this video with people online later on. And Please looking forward to our next Africa-China dialogue. Thank you, everyone. Goodbye.
Thank you. Bye-bye.
Bye.
Thank you.
Welcome.
Bye-bye.